Functional foods and nutraceuticals are the title of my talk today for UNCW's Nursing 411 Complementary and Alternative Medicine. My name is Lisa Rudd. Functional foods. I selected functional foods as a biologically based method of medicine because of the increase in utilization of this technique and its potential for reducing risk of disease and illness. And Hippocrates quoted, "Let food be your medicine and medicine be your food." With the resurgence of this market, there's $126 per capita spent on functional foods in the United States, and it is an $86 billion industry with over 100 million consumers. So it's very promising, but we have to look at alternative treatments and to see about their efficacy and safety. Functional foods can exist under three categories. It could be a food fortified with a known additive from another food. It could be fortified with a new, not previously used functional additive, or it could be a novel food with one or more functional additives. In Japan, where functional foods originated, there are three specific criteria which must be met. It must be a food product which is naturally occurring. It must be able to be incorporated into a person's daily diet and have a specific intended function, for example, to regulate a specific biological process. Definitions of functional foods in Europe, the FOSC basically states that food can either have a nutritional claim or health claim. If it has a health claim, it must be substantiated by 4 criteria. It must have active component, which is identified. Clinical studies need to be performed, and there must be health endpoints that are measured either directly or indirectly, such as with the use of biomarkers, and the evidence has to be statistically there to show that there's a health benefit. Functional foods by the US FDA do not have a formal definition, which results in ambiguity in public education, scientific research, and regulatory requirements for functional foods. This lack of standardization impedes the process of scientific knowledge of health claims and hinders access to consumer knowledge. The history of functional foods are that it basically originated in Japan. Basically, food scientists observed that certain foods had advantageous physiological effects, and this led to special labeling in Japan called FOSHU, Food for Specific Health Use Labels. And basically, there's an entity called the Functional Food Center, or FFC, which defines functional food being either natural or processed food, which contains either a known or unknown biologically active compounds, which in the foods need to be defined, need to be effective, need to be in non-toxic amounts, and need to provide clinically proven, documented health benefits for the management, treatment of chronic diseases. And part of this definition is that functional foods have to have bioactive compounds, part of their clinical documentation of effectiveness. So the controversy behind functional foods centers around 5 major issues. The first one is the lack of standardization among the definition of what is a functional food by different entities. And this leads into the second controversy, which means safety is hard to define if we can't define what we're trying to be considered safe. So cultural, ethical, and legal considerations are important, with considerations such as genetically modified organisms or GMOs, nanotechnology, energy enhanced products, and also legally from products that are made from hemp or marijuana. We have issues with allergens, both natural and unintended contaminants in functional foods, including heavy metals, pesticides, and microbial contamination, and then also the scientific evidence for claims and figuring out if they're safe and effective are important and part of our controversy. So, some people may not want to consume GMOs, and that's part of the safety issue and cultural considerations. They may not want to consume special energy enhanced products that have not very stringent requirements legally and regulatorily, and then also with the cannabis is also a legal issue. With the nanotech utilized foods, one thing that's interesting is that they do not require FDA consultation requiring safety. So it's really based on the manufacturer to ensure that the product is safe and their labeling requirements. So the controversy, of course, there are proponents that think functional foods are a good thing. And one article describes how prebiotics, and symbiotics can improve human health. And they report that probiotics especially can be very useful in maintaining normal flora within the GI tract and can actually improve immune response, reduce cardiovascular risk, lower respiratory illnesses, improve digestion, and actually promote lowering of blood pressure and serum cholesterol. So actually I favor the opposition, and there are two articles that I'm going to talk about regarding the opposition. One of them is actually dealing with the definition of functional foods, and the Functional Foods Center, or FC, advocates for a new definition to be made. Basically, because we have a lack of agreement in what is a functional food worldwide, that causes problems with how functional foods are regulated and how claims are substantiated and how we have access to these types of foods and benefits to the patient. So a starting point is to ensure that we do have agreement what is a functional food, and from that standardization, then everything else scientifically ensues from that. So I'm actually in agreement with the opposition for the controversy against functional foods, and the main issue here is that, for example, in the probiotic market, it's largely unregulated, and this is a huge issue. So with the lack of regulation poses serious issues with quality control, product safety, and efficacy when used to treat a specific disease process, especially something, for example, inflammatory bowel disease, where the patient is really relying on having a consistent product that is safe and effective to be able to rely on that treatment. So standardization of regulatory measures would include looking at the manufacturing process, quality control aspects of it, including the bacterial strains that are used, the type and quantity of bacteria that are used, to ensure that there is consistency between lots and brands, and to ensure that the patient is going to get the desired health outcome. So the FDA currently does not have a regulatory category for functional foods. And so that implies a safety, efficacy, and potential toxicity concern for functional foods, and that they are unregulated in the United States. So my personal interest in functional foods relies on the fact that I am an RN, interested in cost-effective means to improve my own health as well as those for my patients, and involve my patients in education for how they can improve their health safely and cheaply. I also believe that diet and nutrition is very important to a person's overall health, and diet choices can impact their personal health. So this led me to look a little bit closer into functional foods that are on the market and to see whether claims are scientifically based. In a prior life, I was a scientist, so I approached claims with a little bit of skepticism, wanting to know more about the facts and data to support the claims. Overall, I think functional foods offer promise, but must be backed by evidence-based research, mostly for safety, efficacy, quality control, and regulation. My perceptions of functional foods are that some claims are valid while others might be bogus. I encourage education for myself as well as my patients to really assess whether a claim is valid or not, and I look towards peer-reviewed journals, educational and scientific institutions, hospitals, etc., to look at claims to see if they're really backed up. And also think that there are a lot of opportunities for health promotion within functional foods, but that regulatory standards are lacking, especially in the United States. So that functional foods should be tried cautiously and keeping in mind what other medications and supplements a person is taking, and adverse effects and side effects should be looked at whenever a person is taking functional foods. So I would say my support is highly dependent on if the evidence is there to support quality, consistency, and safety. So, potential for practice. With functional foods, as a nurse, I'm interested in applying what I know as a means of encouraging healthy behaviors for myself and patients, and for them to take an active role in their health. However, I recommend that patients are cautious about evaluating health claims and are using reputable sources and letting their primary care physician know about their use or intention to use functional foods. I also plan to screen patients during my assessments and patient interviews for use of functional foods, and also to increase my knowledge of these products, their risks and benefits, cost, interaction with pharmaceuticals, and generally to be a better patient resource. Also, with my potential for practice, I look at my communication with other members of the healthcare team, ensuring that I notify providers of patient use of functional foods and nutraceuticals, and also to evaluate if a patient is talking about wanting to use functional foods, why, what else have they tried, what has brought them down to that path, so I could understand where they're coming from and what their needs are. So also with certain patient populations, we need to be considerate about whether functional foods are appropriate, such as with children, the elderly, and pregnant women. So also with providing information to my patients, I need to make sure that the information is factual, evidence-based, current, and easy to understand. And also it's important for me to consult with dietitians and nutritionists as a means of referral that my patients might have regarding questions related to functional food use. In summary, functional foods and nutraceuticals are continuing to grow in popularity and use. It is important for nurses to screen patients for use of such products and provide education and resources for informed decisions about use. Overall, I promote functional foods if they're backed by evidence-based research for safety and efficacy, and that patients monitor for signs of adverse effects related to their use. Comprehensive medical history, physical assessment, review of prescription medications and supplements they might be using, including herbal products, other functional foods, and nutraceuticals should be evaluated. Functional foods in the U.S. are considered a dietary supplement. So even though that they fall under the FDA, they are not regulated as either drugs or foods. And to me, this is a concern because I think that they should be evaluated as rigorously as a food product or as a drug would be regulated. So in summary, the Dietary Supplement Health Education Act states that safety for functional foods lies within the manufacturer. And so that is concerning, in that the manufacturer is really set to sell product, not necessarily to ensure safety. Functional foods and nutraceuticals show promise in prevention and treatment of chronic illnesses, including cancer, heart disease, and stroke. However, further research is needed to ensure safety of these products. Food is a cultural experience, and so different functional foods could be accepted differently based on culture. For example, the Asian culture eats a lot of soy foods, so that a functional food based on soy would be very appealing for them. So culture other than Asian cultures who have a lower intake of soy, that may not be the best medium to choose a functional food with. Also, for example, Russia and the Ukraine eat a lot of yogurt, so a functional food that is enhanced with lactobacilli would be an obvious choice for them that they would easily embrace. Certain cultures, for example, the Jewish culture, they don't eat pork products. So not saying that I think there'd be a application for a pork product that is a functional food, but that would not be embraced by that culture. But other than a few instances of exceptions for a very specific type of functional food that would not be accepted, or one that would be based on food choices, I haven't read about a culture that would just totally restrict or not be open to the concept of having functional foods. The aims of research for functional foods include looking at safety, effectiveness, presence of adverse or side effects, and cultural aspects of food, making sure that no one is excluded, or that if you're tailoring for a specific market that you take that in mind. And then also traditional medicine needs to be looked at to make sure that there are no adverse interactions and lifestyle choices. And patient education is very key with the use of functional foods. So here's my reference list. I hope that you've enjoyed my presentation and have learned a lot that you can utilize in your practice if you're a healthcare professional or your own personal life, whether you are or not. And I hope that you have something to take forward from watching this video. Thank you so much for your time.